because Democrats know better than to elevate a conspiracy theorist to the top health care job in the country. I know some of my colleagues feel the same way privately. In fact, if the Senate held a secret ballot today, I'll bet Mr. Kennedy would never come close to becoming confirmed, and that many, if not most, Republicans would vote against him. I think most likely most Republicans would vote against him if there were a secret ballot. But sadly and unfortunately for America, Republicans are being strong-armed by Donald Trump and will end up holding their nose and voting to confirm Mr. Kennedy. What a shame. What a travesty. I urge my Republican colleagues to think very carefully one last time before rolling the dice on Mr. Kennedy. A vote to confirm Mr. Kennedy is a vote to make America sicker. Mr. Kennedy has made a living not by promoting public health, but by actively fighting it. Mr. Kennedy is the face of the modern anti-vaccine movement. Mr. Kennedy has spent decades profiting off vaccine misinformation. Mr. Kennedy told me to my face that he would, quote, defer to the president on issues as personal, as deeply held, as important as abortion. Well, how do we know that Mr. Kennedy won't just defer to the president, who is far from an expert on health care, on other issues and health care issues as well? It's simple. We don't. But if he can change his view and defer to the president on something as deeply held as abortion, the likelihood is he'll change his view on many other health care issues to the detriment of the American people. One thing he won't change his views on is vaccines, I am sure, because he's held that so deeply. My Republican colleagues should think very carefully before voting to elevate a vaccine skeptic, a conspiracy theorist, to oversee our health care system. If confirmed, I fear greatly that Mr. Kennedy will take steps that severely undermine public health, weaken safety standards, and put the needs of for-profit corporations ahead of the needs of American families. And sooner or later, public backlash is going to build, and Republicans will have wished they hadn't signed their names for such a troubled nominee. So one final time, I implore my Republican colleagues to reject the nomination of Kennedy to be Secretary of HHS. A vote to confirm Mr. Kennedy is a vote I truly believe many, many Republicans and most Americans will eventually very deeply regret. Now on costs, lowering costs for average families in the budget resolution. Well, my colleagues, ladies and gentlemen, my fellow Americans, welcome to the age of Trumpflation. Trumpflation. If there was, remember on the campaign trail, he said, quote, "When I win, I will immediately bring prices down starting on day one." Starting on day one, he said he will bring prices down. Well, today is day 25, and inflation is not down, but actually up by 3%, higher than what economists were expecting. At the grocery store, the price of pork and chicken and beef are all up. Eggs are up 15% from last month. Gas prices are up 2% from last month. Used cars are up. Auto insurance has become more expensive. And what is Donald Trump doing about all this? He's making the problem worse by threatening trade wars with our own allies. Here's what the CEO of Ford Motor Company said yesterday. The CEO of Ford Motor Company warned yesterday that, quote, a 25% tariff across the Mexico and Canadian borders will blow a hole in the U.S. industry that we have never seen. That's the head of Ford Motor. That's not some liberal Democratic economist. The head of Ford Motor says that the tariffs will blow a huge hole in the U.S. auto industry. What he's doing on tariffs is, again, sort of like everything else. It's sort of a meat axe approach, a slash and burn approach, not looking at each individual case and seeing what's good and what's bad. Inflation is the #1 issue on people's minds. It was the biggest issue during the election, and already Donald Trump is breaking his promise to do something about it. And the American people are starting to take notice already, even though we're only on day 25 of Trump's term. A recent CBS poll showed that 66% of voters do not think Trump is focused enough on lowering prices. 66% of voters do not think Donald Trump is focused enough on lowering prices. And you know what? They're absolutely right. In the 3 weeks that Donald Trump has been president, he's been focused on pretty much everything but fighting inflation, which is the #1 thing people care about. We've seen this maneuver so many times before from Donald Trump. He knows that he has no real answers to fixing inflation. So what does he do? He distracts, he distorts, he says ridiculous and wild, strange things, hoping to distract the country from the fact he's not doing his job. It's why he talks about things like renaming the Gulf of Mexico. It's why he's talking about hotels in Gaza. It's why he's talking about annexing Canada. None of these things have anything to do with the thing that matters most, lowering the cost of living for average American families. And meanwhile, what are the Republicans doing here in Congress? What are my Senate Republican colleagues doing? Are they fighting inflation? Maybe? No way. No way. Republicans are full steam ahead with cutting taxes for the ultra-rich, paid for on the backs of working and middle-class families. Just look at the gargoyle-like budget proposal that the House Republicans released yesterday. Republicans want to make billionaires even wealthier by raising costs for working people. The Republican budget slashes nutrition programs that help 40 million Americans put food on the table. The Republican budget proposes massive cuts to Medicaid, threatening health care for tens of millions of people. It will make food, health care, energy, and housing more expensive, all to cut taxes for the ultra-rich, hurting the middle class, raising costs for the middle class to help the ultra-wealthy. The Republican budget plan can be described in one word: radical. Republicans should remember well what happened the last time they cut taxes for the ultra-wealthy. It backfired with the rest of America. If Republicans try to cut taxes for the ultra-rich again, history is going to repeat itself, and it will cost them dearly at the ballot box. I yield the floor and note the absence of a quorum.
The clerk will call the roll.
Ms. Alsobrooks.
Mr. President,
The senator from Arkansas.
I ask that we dispense with the quorum call.
Without objection.
Thank you, Mr. President. I ask unanimous consent that our intern on the Committee on Agriculture, Nutrition, and Forestry, Callie Henneberry, be granted floor privileges through May 9th, 2025, and that CFTC detailee Kevin Webb also be granted floor privileges through the end of the 119th Congress.
Without objection.
Thank you, Mr. President. Mr. President, I'm honored to speak on the floor of the Senate and support Brooke Rollins to be Secretary of Agriculture. The Senate will vote on her nomination to this cabinet position today, and I encourage my colleagues to vote yes. America's farmers, ranchers, foresters need a leader at USDA who will be an advocate for their livelihoods in rural America and be a strong voice to address the pressing needs of our agricultural community. Brooke Rollins is that person. In her hearing before the Senate Agriculture Committee, she pledged to do everything within her ability to ensure that our farmers, ranchers, and rural communities thrive. And we know she will follow through on that because rural America helped shape her into what she is today. She's leading a life of service that began with membership in her small town Texas FFA chapter and continues to credit her FFA advisor for his support and mentorship in her agricultural career. She invited him to attend the nomination hearing before the Senate Agriculture Committee last month, along with the Texas State FFA officer team she served with in high school. Texas Governor Rick Perry knew Brooke Rollins had a heart for Texas farmers and invited her to join his policy team where she advocated for agriculture. She continues that passion today. Her executive leadership during the first Trump administration to serve in this position and advocate for family farms. She understands the significant responsibility of this role during one of the most economically challenging times for agriculture producers. Hardworking farmers who grow our food are struggling to operate, let alone make a profit in this current economic climate. High inflation and steep input costs far outpacing depressed market prices have put many farm families on a course towards bankruptcy, with multi-generational operations fighting to continue their family legacy. In December, Congress approved natural disaster and emergency assistance to help producers obtain critical operating loans for this crop year. Ensuring delivery of this aid will be one of her first priorities as Secretary. I'm confident she will pursue policies to help rural American live up to its potential. While we first met during the first Trump administration, I've had the opportunity to get to know her better during her confirmation process, and she has demonstrated her enthusiasm for being a voice for small-town American and agriculture producers. I'm grateful she is willing to take on this big responsibility and willing to be part of the solution to help rural America at this time of unprecedented challenges. As chairman of the Senate Agriculture Committee, I've met with farmers, ranchers, and agricultural stakeholders from all over the country, and they have been sounding the alarm of the dire circumstances they face in producing a safe, affordable, and abundant supply of food. Farmers from my home state of Arkansas shared with the committee last week about the difficult conversations they are forced to have right now about continuing their multi-generational farms and risking their family's future in the industry. Unfortunately, this is a conversation many more farm families across the country will have if we do not act quickly. Congress must deliver an updated 5-year farm bill that modernizes the safety net in order to maximize liabilities in order to minimize the liabilities farm families take on when they plant their crops. Food security is national security. Our country is blessed to have grocery stores stocked with food to put on our tables. This is the result of the hard work of our farmers and ranchers. These producers need the tools to be successful and continue to grow the food, fiber, and fuel our nation depends on. I know Brooke Rollins shares my commitment to enhancing the policies that help farm families and rural communities thrive. Given her executive leadership, she is well prepared to hit the ground running, and she walks through the doors of USDA's secretary and deliver the certainty and predictability our producers need. I look forward to working with her to strengthen rural America and the men, women, and families who call it home. I also want to thank everyone on both sides of the aisle in making it such that we could do this in such a expeditious way. It took a lot of cooperation. I think it just shows how important our farmers are to both Democrats and Republicans. It's one of the few areas that's not a partisan issue. It's all about helping the men and women that work so very hard to provide the food that we need. So with that, I yield back.
Mr. President.
Majority Leader.
Mr. President, anybody who knows me well knows that I say this a lot, and that is that agriculture is the lifeblood of South Dakota and the lifeblood of our country. And farmers and ranchers are hard at work every single day to feed America and the world. But what I hear lately from farmers and ranchers is not good. Agricultural producers across the country have faced strong headwinds in recent years. Higher input costs, high interest rates, lower commodity prices, all leading to declining farm income year after year. Natural disasters have struck many of our farm regions, and the bird flu continues to ravage agriculture across the country. Of course, the last few years, the Biden administration was hardly much help. It imposed burdensome regulations like waters of the United States that threatened to devastate the farm sector. The administration put expanding market access on the back burner while our agricultural trade deficit grew to record levels. And their profligate spending led to inflation that hit farmers and ranchers especially hard in the form of higher input costs. Meanwhile, Democrats here in Congress failed to prioritize a modernized farm bill to support agriculture through these challenges. And we are now more than a year past due for an updated farm bill. Mr. President, American farmers and ranchers deserve better. much better. And I expect things will be different under President Trump. I know that farmers and ranchers will have a friend in Brooke Rollins, the President's choice for Secretary of Agriculture. Mrs. Rollins grew up in the small agricultural town of Glen Rose, Texas. She spent summers working for her family on their farm in Minnesota, helping with their corn, potato, and soybean crops. She was a 4-H'er, an FFA state officer, and a barrel racer. And her 4 kids are keeping up the family's way of life, showing cattle in Texas. After studying agriculture development at Texas A&M, Mrs. Rollins went to work for then Governor Rick Perry, where she worked on agricultural policy. She then continued her ag work by building up a Texas think tank empowering the voices of farmers, ranchers, and rural communities. Then she served in President Trump's first administration, first leading the Office of American Innovation, and then the Domestic Policy Council. This President, Brooke Rollins, is a policy wonk with a farmer's heart. She understands the needs of agriculture producers, and she knows how to deliver results. And she promises to get right to work after she is confirmed on 4 key priorities. First, getting disaster and economic aid out the door and into the hands of farmers. Second, getting the bird flu and other animal disease outbreaks under control. Third, getting the Farm Bill done. And finally, revitalizing the U.S. Department of Agriculture to focus on its core mission and put America and American agriculture first. Mr. President, I'm looking forward to working with Mrs. Rollins on these key priorities. Under this Republican majority, delivering a modernized Farm Bill is a priority. And I'm glad that Mrs. Rollins has pledged to work with Congress on one of the top Farm Bill needs, which is strengthening the farm safety net, which is essential to keeping existing operations going and encouraging the next generation of producers to get started. I was also pleased to hear Mrs. Rollins acknowledge the need to improve management of national forests. The Black Hills National Forest, among others across the country, has seen its timber industry decimated by bad management policies. So I look forward to working with USDA under Secretary Rollins to provide relief from the dire situation in western South Dakota. And I'm encouraged as well that she will prioritize getting disaster and economic assistance out the door. Last year, many parts of the country suffered from natural disasters, including South Dakota. And as I said, farmers and ranchers have suffered lower commodity prices and declining incomes. In December, Congress passed $31 billion in agricultural disaster and economic assistance. And we need to get that money into the hands of farmers and ranchers working to rebuild. Mr. President, Brooke Rollins understands the mission of USDA. She understands the day-to-day needs of America's farmers, and she has the expertise to deliver results. I trust that she will put America's farmers and ranchers first as Secretary of Agriculture, and I look forward to working with her in this role. Mr. President, later today I will introduce a bill to repeal the death tax. As I mentioned, as a resident of a rural state filled with family farms and ranches, I have made death tax repeal a priority for a long time. And I was proud to help secure a doubling of the death tax exemption in the 2017 Tax Cuts and Jobs Act. This doubled exemption has provided certainty to a lot of farms and ranches and small businesses over the past 7 years. But the expanded exemption is expiring at the end of this year. And it's my hope that we will not merely extend this exemption, but that we will get rid of this fundamentally flawed tax once and for all. Mr. President, the death tax is fundamentally flawed both in theory and in practice. There should be a limit to how many times the government can tax you. The money you leave at your death has already been taxed by the government at least once, which makes the death tax double taxation. And the government isn't even profiting all that much from this double taxation. That's right, the death tax accounts for a teeny tiny fraction of government revenue. In fact, there's reason to believe that the government would collect more in taxes if it got rid of the death tax entirely, due to the economic growth and job creation that would stem from its elimination. So how is there any support left for this burdensome tax? Well, Mr. President, that's a good question. For some, of course, heavy taxation is axiomatic. Do well, their thinking runs, and the government should come after you. Some think that you shouldn't be able to pass the results of hard work down to your children upon your death. Well, Mr. President, death tax proponents tend to talk as if the death tax only affects the extremely wealthy. But nothing, of course, could be further from the truth. The death tax can sweep up those who have very little in the bank, notably family farms and ranches and family businesses. How? Well, farming and ranching is often a cash-poor business. A farmer might have substantial-looking assets on paper, but the vast majority of that is land and farming equipment. Only a small fraction of it is money in the bank. On top of that, farmland can often be valued at a level that is inconsistent with its agricultural productivity value. A farmer might have land with a substantial value on paper, but the crop yield on that land could be worth far, far less. So what happens when a farmer or rancher dies and his estate is subject to the tax? There's a very good chance that his liquid assets, in other words, the cash that he has available in the bank, won't come close to covering the tax bill from the federal government. And the only alternative for his heirs may be to start selling off land or farm equipment to pay the tax. In some cases, they will be able to keep the farm, just a smaller version of it. In others, they may have to sell off the family farm entirely. The case is similar with family-owned businesses. The owner might appear to have substantial-looking assets on paper, but only a small fraction of that may be money in the bank. The vast majority may be tied up in the business. And once again, when the federal government comes around demanding a huge portion of this individual's taxable estate, there may not be anywhere close to enough money in the bank to pay the tax. To pay the federal government, the owner's descendants will have to sell off part or all of the family business. Now, Mr. President, family farms and ranches are the lifeblood of rural communities in South Dakota. They're a source of jobs. They provide support for local businesses. They help build up local schools and local infrastructure. Losing a local farm can hit rural communities very, very hard, especially when that farm or ranch is bought up by an out-of-state business with few ties to the community and limited interest in building it up. And Mr. President, it's not just those who actually get hit by the estate tax who suffer. A lot of family farms and ranches and family businesses spend a lot of time and money on estate planning to avoid being hit by this tax. That's time and money that could have gone into building their business, investing in new equipment, hiring new workers, and the list goes on. Some set aside capital to prepare for the death tax, capital that, again, could go into building up the farm or ranch or hiring new workers for the family business. As one of my Democrat colleagues, the senior senator from Washington, said a while back, and I quote, "The estate tax is bad for businesses, it is bad for workers and new job creation, and it is bad for our communities who are watching their local family-owned businesses get swallowed up by large corporations," end quote. Well, Mr. President, as I said, we protected a lot more family farms and family businesses by doubling the death tax exemption in the Tax Cuts and Jobs Act back in 2017. But we didn't protect them all. And those we did protect will lose those protections at the end of this year. It is time to end this punishing and burdensome tax once and for all. I want to thank my Republican colleagues who joined me in sponsoring this legislation. And Mr. President, I hope that 2025 will be the year that we permanently bid farewell to the death tax. Mr. President, I yield the floor, and I suggest the absence of a quorum.
Clerk will call the roll.
Ms. Also Brooks.
Ask unanimous consent to vacate the quorum call.
Without objection.
Mr. President, I ask unanimous consent that I be permitted to speak for up to 15 minutes, Senator Crapo for up to 5 minutes, and Senator Schumer for 2 minutes prior to the scheduled votes.
Is there an objection? Without objection.
Mr. President, late into the night, senators spoke on the Senate floor about why Robert F. Kennedy Jr. is the least qualified nominee to ever be tapped as America's chief health officer. On issue after issue, Mr. Kennedy has demonstrated a profound lack of knowledge at best and deeply dangerous views at worst. Mr. Kennedy has refused to tell Americans how we would manage health care issues that they're deeply worried about: vaccine safety, women's reproductive health, drug pricing, and affordable health care, to name a few. This leaves, Mr. President, millions of Americans alarmed about the future of health and science in America. Last week, 2 Oregon medical students approached me to talk about Mr. Kennedy's nomination. These medical students told me they were less concerned about the damage Mr. Kennedy would do as HHS Secretary in the weeks and months to come. These medical students are not only worried about the prospect of losing cures, treatments, and medical breakthroughs if Mr. Kennedy is confirmed. These medical students from Oregon told me that his unwillingness to take science and medical data seriously is going to harm science for decades to come. So I ask my colleagues to think about those medical students' words. Is that a legacy you want to leave behind as a result of supporting Mr. Kennedy? Senate Democrats have been making this exact case. In his hearing before the Finance Committee, I asked Mr. Kennedy to square his anti-vaccine views with more recent statements designed to appease a number of our senators who are quite nervous about his nomination. In his testimony, he used the fact that his own children were vaccinated to prove he was not anti-vaccine. But the record shows that just a few years ago, he said he would, quote, do anything and pay anything to go back in time in order to prevent them from getting those vaccines. Elsewhere in his testimony, Mr. Kennedy stated he was not anti-vaccine, but rather pro-safety. But about 18 months ago, he said on a podcast, and I quote, no vaccine is safe and effective. In other words, Mr. President, in the Senate Finance Committee, we brought the evidence, we brought the receipts, and Mr. Kennedy said nothing to actually disavow his prior statements. He stuck by the time-worn tactics of a conspiracy theorist. Always ask for more evidence and never accept the evidence that's placed in front of you. Even some of my colleagues on the other side of the aisle are now deeply disturbed by Mr. Kennedy's refusal to entertain evidence that would require him to change his mind on vaccine safety. Nevertheless, it sure looks like my Republican colleagues have bowed to pressure from Donald Trump and are poised to hand Mr. Kennedy the platform he has been seeking for 2 decades to push fringe views. So before the Senate votes, I'd like to take a moment to talk a little bit about the fights ahead on health care. Republicans in the House are already pressing ahead this morning with their plan to kick millions of Americans off of their health insurance in order to fund more tax cuts for those who are very wealthy. And as HHS Secretary, Mr. Kennedy is going to be a key player in this effort. While senators were on the floor speaking yesterday, the Senate Budget Committee debated a budget resolution that unlocks the legislative tools Republicans need to make good on their go-it-alone plan. At the same time, the House Budget Committee released its own budget resolution that will be debated today. Mr. President, what is clear in both of these blueprints, in their game plan, is that Medicaid cuts are at the top of the list. 81 million Americans rely on health care coverage under Medicaid, and the CHIP program for kids. Those people are folks with disabilities, low-income families, seniors, and of course children. The damage and destruction to American families if Republicans go through with their plans to gut Medicaid cannot be overstated. Take nursing homes, for example. 2 out of 3 nursing home residents are currently being covered for their health care by Medicaid. Imagine you visit your mom in her nursing home in the months after the Republican bill makes steep cuts to Medicaid. Your mom complains there are fewer and fewer staff. She had to wait more than an hour after calling for help to use the bathroom on several occasions. Next time you visit, she tells you some of the new staff don't have time for her. You learn that the facility no longer has the resources to conduct background checks and that they're desperate for workers. A few weeks later, the facility manager pulls you aside to deliver some bad news. Her nursing home can no longer accept patients with Medicaid after steep federal cuts to the program. Unless you can find another facility that accepts Medicaid, you've got to pay the high monthly costs out of your own pocket. Suddenly, and with no warning, you've got impossible options. Either you scramble to find the money to cover a new facility that costs thousands of dollars a month, or you bring your mom home with you. So between holding down a full-time job and raising young kids, suddenly you have to deal with making sure that your mom gets full-time care, and that requires nursing assistance around the clock. Unfortunately, this case I described is something you see in every nook and cranny of America. I know that from my days as co-director of the Gray Panthers. And I know that many of your friends and neighbors with aging parents and grandparents in nursing homes are facing the catastrophe that I've just described. Now, Republicans are going to do somersaults to disguise their cuts to Medicaid, and they're going to describe it in healthcare lingo that they think plays well with people. For Republicans, every single child, senior, or family struggling to pay the bills that gets denied coverage is a win. And that brings us to Mr. Kennedy. During his confirmation hearing on everything from abortion to vaccines to Medicare and Medicaid, Mr. Kennedy was given ample opportunity to go on the record about how he would improve these programs, bring down costs, save taxpayers money, and improve care. Instead, he showed a complete lack of understanding of the basics of Medicaid and how it functions. I personally believe it shouldn't be too much to ask for the future CEO of Medicaid to understand how important it is to provide affordable coverage for millions of families. Republicans, with Donald Trump at the helm, are steering our country toward a health care cliff. Their ultimate objective is to take away Medicaid from as many people as they can. Colleagues, so much for making America healthy again. What the American people need is a leader who will be the voice of reason in the room as Trump and his assistants in Congress start slicing and cutting. Our country needs a leader at Health and Human Services who's actually going to work to improve care and lower costs, defend the reproductive freedoms of families, and listen in particular to facts and science. The American people have no reason to believe, based on the record, the evidence that the Senate Finance Committee has accumulated, to believe Mr. Kennedy will be that leader. There is no question the health care system in America needs reforms. It's falling short, and Democrats want to work in a bipartisan way on those issues. We are disillusioned by a system that puts profits over patients in too many circumstances. Nobody on this side of the aisle is arguing for the status quo. But the solution, colleagues, and I'm closing with this, does not lie in Donald Trump's, quote, concept of a plan to make our country less healthy, less safe, and less successful. When kids are kicked off their Medicaid coverage and forced to go without basic medical care and grow up with chronic illnesses that leave them in a lifetime of pain and suffering, Republicans are going to regret any vote they give to Robert Kennedy. When seniors are told they have to vacate their nursing homes because it no longer accepts Medicaid, Republicans again will regret a vote for Robert Kennedy. When families are struggling to pay the bills and they're landed with a mountain of medical debt because their kid got sick and they were kicked off their insurance, finally Republicans will regret any decision they give, any vote they give to Robert Kennedy. Mr. Kennedy will no doubt be right alongside Republicans, a willing participant in this future for health care that I've described today that is really stepping back from progress that has been made. I urge a no vote, colleagues, and I yield the floor.
Mr. President.
Senator from Idaho.
Thank you, Mr. President. I rise today in support of Robert F. Kennedy Jr.'s nomination to be Secretary of the U.S. Department of Health and Human Services and to urge my colleagues to vote in favor of his confirmation. Contrary to the attacks that have constantly been made on him, he has made it very clear that he will support safe vaccinations and just wants to see that the research on them is done and done well. When his nomination for the role of Secretary of HHS was announced, Mr. Kennedy stated, "We have a generational opportunity to bring together the greatest minds in science, medicine, industry, and government to put an end to the chronic disease epidemic facing Americans." I agree with him. We've got to get into the business of making America healthy again. Mr. Kennedy's dedication to this commitment has been apparent throughout the nomination process. He will bring a fresh perspective to health care, prioritizing consumer choice, information transparency, and early interventions to strengthen the well-being of all Americans. He has been responsive to a wide variety of questions from members on both sides of the aisle, appearing before 2 committees and answering hundreds of questions for the record, not to mention going through the extensive vetting process of the Finance Committee, which I chair, which is the most extensive vetting process that any candidate in the Senate goes through, for a position in this administration goes through in the Senate. While some of my colleagues continue to question his financial agreements, Mr. Kennedy met and then exceeded the requirements set forth by the Office of Government Ethics. Mr. Kennedy has participated in one of the most extensive processes, as I've said, that our Senate puts a nominee through, and has succeeded in meeting those standards. And I encourage my colleagues to support his nomination. Now, before I close, I want to respond briefly to the comments that we've heard today here on the floor and all day yesterday in a long Budget Committee hearing to set up the first reconciliation legislation to come before the Congress. It was said today that Republicans are going to take Medicaid away from children. They are going to take health care away from seniors. It was said yesterday that we were going to go after pretty much old people, young people, middle-aged people, and every other kind of people, because we are going to destroy the support base that they have here in the federal system. The fact is, this is the politics of fear, the politics of claiming things that are going to happen which are not going to happen. The reality is that yesterday's Budget Committee meeting was not on health care. There was nothing done in the meeting yesterday that would have done any of the things that you've heard on the floor today. What we did do yesterday was to set up a process so we can provide some significant extra spending authority to our government to close the border and deport the violent criminals who have come into our country in the millions in the last few years. We had another provision in it to give significant new resources to our national defense so that we can build back our Department of Defense and the authority of those in our armed services, the ability of those of our armed services members to have the technology and the equipment and be capable of responding to threats to our nation. And finally, We restarted and charged up our use and engagement in producing America's energy in America so that we can get back into the business of being independent and not relying on other nations for our energy policy. Those are the three things that we focused on in the committee yesterday. And by the way, each one of those was a little bit costly, and every one of those was offset so that there was no increase in federal spending. Mr. President, I think we need to argue over facts when we get into these debates. We're going to have a tremendous number of debates. And yes, we will debate on health care at some point. But yesterday, and what we did yesterday, was focused on the border, on national defense, and on reboosting our energy production in America. I encourage a strong yes vote for Robert F. Kennedy to be the next Secretary of the U.S. Department of Health and Human Services.
Mr. President,
Senator from Oregon.
I would ask unanimous consent for 1 minute for an opportunity to respond to my colleague from Idaho.
Without objection.
Thank you, Mr. President. I would only say to my friend from Idaho that he says this is not going to happen, that people are going to be safe and seniors on Medicaid and the like will be safe. I would just say to my colleague, it starts today in the other body of Congress. I'd say to my colleague, the process of setting in motion these cuts to essential health care services begins today. We can read about it in the publications about the congressional schedule. I look forward to working with my colleague when we can find common ground. But on this point that it's not going to happen, everybody's going to be safe, the efforts to cut these vital programs, including Medicaid, begins this morning in the other body, and I yield the floor.
Could I have 30 seconds to just respond? I ask unanimous consent.
Without objection.
Mr. President, I would simply say that we hear this every time we look at trying to address the spending excesses in our government. And I will just say to my colleague and to everyone, we're not going to take health care away from children. We're not going to take health care away from adults, from seniors, or middle-aged people. We are not going to attack the benefits that people get under Medicare. And frankly, we will reform some of the spending, yes, but we will not do all of the terrible things that are being spun up to try to attack this effort to control the excessive spending in our government.
Democrat leader.
Thank you, Mr. President. Mr. President, the fact that we're here right now, that we're even here right now, voting on this wildly unqualified conspiracy theorist to trust with one of the most life or death jobs, HHS Secretary, charged with protecting the health of every single American, should be an affront to every senator and the millions of Americans that will be impacted by this horrific nomination. My colleagues on the other side of the aisle, I implore you, think one last time about this vote. My colleagues on the Republican side, you know the consequences of what you're doing. My colleagues on the Republican side, you know how dangerous this is. My colleagues on the other side, you know you are not putting your constituents, their health, their families first when you vote yes. To quote my colleague, the junior senator from Texas, just a few years ago, he said, quote, "We need an expert. We need a scientist. We need someone who knows something about health care heading the Health and Human Services Department." Well, which is Robert Kennedy? An expert? A scientist? Or what about the senior senator from Louisiana, the chair of the Health Committee, and a well-respected medical professional himself? A few years ago, here's what he said. Previous HHS secretaries have had a pharmaceutical industry background, have been a state health commissioner, have run health systems, have been governors. Somebody who has had a background in actually administering the programs that HHS administers. I ask my colleagues, which of these qualifications does RFK possess? You know the answer, none of them. The question in front of this body today, the question in front of this body is not simply to confirm RFK to run the nation's health department. The question before us is very simple. Which is more important to you? The health and well-being of your constituents, or blindly obeying orders, knowing full well the dangerous impacts your vote will enable? I plead with you one more time, rethink this issue. This is dangerous, this is wrong, very wrong. I yield the floor.
Under the previous order, all post-cloture time is expired. The question occurs on the Kennedy nomination. Is there a sufficient second? There appears to be. Clerk will call the roll.
Ms. Also Brooks, Ms. Baldwin, Mr. Banks, Mr. Barrasso, Mr. Bennett, Mrs. Blackburn, Mr. Blumenthal, Ms. Blunt Rochester, Mr. Booker, Mr. Bozeman, Mrs. Britt, Mr. Budd, Ms. Cantwell, Mrs. Capito, Mr. Cassidy, Ms. Collins, Mr. Coons, Mr. Cornyn. Ms. Cortez Masto. Mr. Cotton, Mr. Kramer, Mr. Crapo, Mr. Cruz, Mr. Daines, Ms. Duckworth, Mr. Durbin, Ms. Ernst, Mr. Fetterman, Mrs. Fisher, Mr. Gallego, Mrs. Gillibrand, Mr. Graham, Mr. Grassley, Mr. Haggerty, Ms. Hassan, Mr. Hawley, Mr. Heinrich, Mr. Hickenlooper, Ms. Hirono, Mr. Hoven, Mr. Husted, Mrs. Hyde-Smith, Mr. Johnson, Mr. Justice, Mr. Kane, Mr. Kelly, Mr. Kennedy, Mr. Kim, Mr. King, Ms. Klobuchar, Mr. Langford, Mr. Lee, Mr. Lujan, Ms. Lummis, Mr. Markey, Mr. Marshall, Mr. McConnell, Mr. McCormick, Mr. Merkley, Mrs. Moody, Mr. Moran, Mr. Moreno, Mr. Mullen, Ms. Murkowski, Mr. Murphy, Mrs. Murray, Mr. Ossoff, Mr. Padilla, Mr. Paul, Mr. Peters, Mr. Reed, Mr. Ricketts, Mr. Risch, Ms. Rosen, Mr. Rounds, Mr. Sanders, Mr. Schatz, Mr. Schiff, Mr. Schmidt, Mr. Schumer, Mr. Scott of Florida, Mr. Scott of South Carolina, Mrs. Shaheen, Mr. Sheehy, Ms. Slotkin, Ms. Smith, Mr. Sullivan, Mr. Thune, Mr. Tillis. Thank you. Mr. Tuberville. Mr. Van Hollen. Mr. Warner. Mr. Warnock. Ms. Warren. Mr. Welch. Mr. Whitehouse. Mr. Wicker. Mr. Wyden. Mr. Young. Senators voting in the affirmative: Bozeman, Cornyn, Crapo, Graham, Mullen, Risch, Rounds, and Tuberville. Senators voting in the negative: Bennett, Gallego, Lujan, Markey, Schumer, and Wyden. Mr. Wicker, aye. Mr. Marshall, aye. Mr. Moreno, aye. Mrs. Britt, aye. Mr. Heinrich, no. Mr. Justice, aye. Mr. Sullivan, aye. Mrs. Blackburn, aye. Ms. Baldwin, no. Mr. Murphy, no. Mr. Cotton, aye. Ms. Also Brooks, no. Ms. Warren, no. Mr. Young, aye. Mr. Kelly, no. Mr. Johnson, aye. Ms. Ernst, aye. Mr. Durbin, no. Mr. Cassidy, aye. Mr. Sanders, no. Ms. Hassan, no. Mr. Peters, no. Mr. Barrasso, aye. Mr. Reed, no. Mr. Curtis, aye. Mr. Ricketts, aye. Mr. Thune, aye. Mr. Ossoff, no. Mr. Haggerty, aye. Mr. Van Hollen, no. Ms. Rosen, no. Mr. Banks, aye. Mr. Tillis, aye. Ms. Duckworth, no. Mr. McCormick, aye. Ms. Cortez Masto, no. Mrs. Hyde-Smith, aye. Ms. Blunt Rochester, no. Ms. Collins, aye. I did, thank you. Mr. Langford, aye. Mr. Sheehy, aye. Mrs. Murray, no. Mr. Hoven, aye. Mr. Scott of South Carolina, aye. Mr. Merkley, no. Mr. Budd, aye. Mrs. Gillibrand, no. Mr. Moran, aye. Mr. Fetterman, no. Mr. Schatz? No. Ms. Smith? No. Mr. Husted, aye. Ms. Lemus? Aye. Mrs. Capito, aye. Ms. Cantwell, no. Mr. Kramer, aye. Mr. Kim, no. Ms. Murkowski, aye. Mr. Coons, no. Mr. Kane, no. Mr. Warner, no. Mr. King, no. Mr. Warnock, no. Mr. McConnell, no. Mr. Schmidt, aye. Mr. Cruz, aye. Mr. Lee, aye. Mrs. Moody, aye. Mr. Daines, aye. Mr. Schiff, no. Mr. Booker, no. Mr. Padilla, no. Mr. Blumenthal, no. Mr. Hawley, aye. Mr. Kennedy, aye. Ms. Hirono, no. Mr. Grassley, aye. Fisher, aye. Ms. Slotkin? No. Ms. Klobuchar? No. Mr. Whitehouse? No. Mr. Hickenlooper? No. Mr. Scott of Florida, aye. Mr. Welch? No. Mrs. Shaheen, no. Mr. Paul, aye.
On this vote, the yeas are 52, the nays are 48. The confirmation is confirmed. Just number 4? Yeah, but just number 4. Under the previous order, the motion to reconsider is considered made and laid upon the table, and the President will be immediately notified of the Senate's action. Under the previous order, the cloture motion with respect to the Rollins nomination is withdrawn. The clerk will report the Rollins nomination.
Department of Agriculture, Brooke Rollins of Texas to be Secretary.
The question occurs on the nomination. Is there a sufficient second? There appears to be. Clerk will call the roll.
Ms. Also Brooks, Ms. Baldwin, Mr. Banks, Mr. Barrasso. Mr. Bennett, Mrs. Blackburn, Mr. Blumenthal, Ms. Blunt Rochester, Mr. Booker, Mr. Bozeman, Mrs. Britt, Mr. Budd, Ms. Cantwell, Mr. Cassidy, Ms. Collins, Mr. Coons, Mr. Cornyn, Ms. Cortez Masto, Mr. Cotton, Mr. Kramer, Mr. Crapo, Mr. Cruz, Mr. Curtis, Mr. Daines, Ms. Duckworth, Mr. Durbin, Ms. Ernst, Mr. Fetterman, Mrs. Fisher, Mr. Gallego, Mrs. Gillibrand, Mr. Graham, Mr. Grassley, Mr. Haggerty, Ms. Hassan, Mr. Hawley, Mr. Heinrich, Mr. Hickenlooper, Mr. Rono, Mr. Hoven, Mr. Husted, Mrs. Hyde-Smith, Mr. Johnson, Mr. Justice, Mr. Kane, Mr. Kelly, Mr. Kennedy, Mr. Kim, Mr. King, Ms. Klobuchar, Mr. Langford, Mr. Lee, Mr. Lujan, Ms. Lummis, Mr. Markey, Mr. Marshall, Mr. McConnell, Mr. McCormick, Mr. Merkley, Mrs. Moody, Mr. Moran, Mr. Moreno, Mr. Mullen, Ms. Markowski, Mr. Murphy, Mrs. Murray, Mr. Ossoff, Mr. Padilla, Mr. Paul, Mr. Peters, Mr. Reed, Mr. Ricketts, Mr. Risch, Ms. Rosen, Mr. Rounds, Mr. Sanders, Mr. Schatz, Mr. Schiff, Mr. Schmidt, Mr. Schumer, Mr. Scott of Florida, Mr. Scott of South Carolina, Mrs. Shaheen, Mr. Sheehy, Ms. Slotkin, Ms. Smith, Mr. Sullivan, Mr. Thune, Mr. Tillis, Mr. Tuberville, Mr. Van Hollen, Mr. Warner, Mr. Warnock, Ms. Warren, Mr. Welch, Mr. Whitehouse, Mr. Wicker, Mr. Wyden, Mr. Young. Senators voting in the affirmative: Barrasso, Bozeman, Capito, Cotton, Crapo, Cruz, Daines, Fisher, Gallego, Hickenlooper, Hyde-Smith, Justice, Kennedy, Klobuchar, Langford, Lee, Lummis, Marshall, McConnell, Moran, Moreno, Mullen, Paul, Rosen, Scott of South Carolina, Shaheen, Sheehy, Slotkin, Welch. Senators voting in the negative: also Brooks, Blumenthal, Hirono, Kim, King, Lujan, Padilla, Smith, Whitehouse, and Wyden. Ms. Markowski, aye. Mr. Kramer, aye. Mr. Fetterman, aye. Ms. Collins, aye. Mrs. Gillibrand, no. Mr. Wicker, aye. Mr. Schatz, no. Mr. Rounds. Mr. Rounds, aye. Mr. Ricketts. Mr. Ricketts, aye. Ms. Warren. Ms. Warren, no. Mr. Reed. Mr. Reed, no. Mr. Tuberville. Mr. Tuberville, aye. Mr. Johnson. Mr. Johnson, aye. Mr. Hoven. Mr. Hoven, aye. Mr. Van Hollen. Mr. Van Hollen, no. Mr. Cornyn. Mr. Cornyn, aye. Mr. Kelly. Mr. Kelly, no.